Lung cancer is one of the worst cancers that anybody can have. Lung cancer is the deadliest cancer that we know. It kills more people than breast cancer, prostate cancer, and colon cancer combined.
Lung cancer is uncontrolled growth of the lung cells. They arise from the airways. They can also arise from the so-called parenchyma of the lung. There are rarer varieties of lung cancer which can arise from the coverings of the lung.
So about 60 to 70% of lung cancers are caused by cigarette smoking. But there are about 10 to 20% of patients in whom the cancer can occur even without smoking. That being said, we are now discovering that inhalation of certain chemicals, such as vaping, may put people at risk for lung cancer as well.
Our only hope at treating lung cancer is to detect it early. If we can catch it early, then we have a chance at a very good response. Stage 1 cancer, usually we have about more than 90% survival if we can catch it early.
So the reason someone would choose Franciscan for their lung cancer care would be because we provide the most technologically advanced services. Even these services are for both diagnostic purposes as well as for therapeutic purposes.
We provide a multidisciplinary approach. There's a team of physicians, we all work together. Because right now, as you know, when we talk about taking care of an oncology patient, sometimes we say it takes the whole village. There's a team of physicians, team of nurses, all the staff that is needed. I think it definitely improves the patient care and experience in terms of timeliness and being able to involve everybody in taking care of the patients.
Now when we do an X-ray or a CAT scan and we found a little nodule, in the past we had to do regular bronchoscopy. Unless the tumor is in the proximal airway or the airway that are easily seen by the scope, it was difficult to get a tissue diagnosis so that we can tell what kind of cancer it is. The ION platform, which is a robotic bronchoscopy, offers an option to reach those small nodules that are in the periphery of the lung without having to stick a needle from outside the lung and increase the risk of collapsing the lung and having complications with that. Even small nodules smaller than 1 centimeter can be reached with the ION robot bronchoscope.
For early stage lung cancers, obviously surgery is a very good option with very high cure rates. We can do a special procedure called stereotactic body radiotherapy where we provide very high doses of radiation for early stage lung cancers and have very high cure rates and is an excellent alternative to patients who aren't surgical candidates. For more advanced lung cancers, we usually need to deliver a combination of chemotherapy and radiation. Now with the advancement in both radiation as well as in medical oncology, we're seeing cure rates that we've never seen before.
We have a very comprehensive lung tumor board. We have multiple medical oncologists. We have our pulmonary group participating. We have radiology, radiation oncologists, thoracic surgeon, our navigators, our pharmacists. So yes, we have a very comprehensive multidisciplinary lung tumor board.
Tumor board, we bring cases, challenging cases, we get opinions of whether it's the pulmonologist or the surgeon and the medical oncologist, where we all put our heads together and really look at the entire patient. It really does help to familiarize ourselves with multiple patients.
It is very important to try to catch lung cancer early. And at Franciscan and Lafayette, we have a program for people who are at high risk for lung cancer. Those people are people who have smoked for many years and has quit smoking in the last 10 to 15 years. They qualify for a low-dose CT of the chest, which is a CAT scan of the chest that involves low radiation. The radiation is almost equal to a regular chest X-ray, and this CAT scan will help us detect early lung nodules, which may in the future develop into cancer.
I would use compassion and empathy to describe how we take care of patients. That combined with state-of-the-art diagnostic techniques and state-of-the-art treatments that are being made available on a day-to-day basis, but which our facility has access to the other staff, such as like the financial counselor, for example, or the social worker, and that makes a team. And if everybody's operating with that same underlying principle of compassion and empathy, it just makes the care spectacular.